What is it like coming to Rhodes Chiropractic as a new patient? That is what we are going to be talking about today. So, this episode is being recorded for those of you that have never been a patient at Rhodes Chiropractic or never been to a chiropractor, and you're wondering, what is it like? We have lots of new patients here at Rhodes Chiropractic, and some people are 10 out of 10 excited about chiropractic. Some are a 1 out of 10 scared, and they just don't know what do chiropractors do. And so this episode is to outline and to be shared with anyone that is going to be a new patient, interested in becoming a new patient at a chiropractic office, but mostly here at Rhodes Chiropractic. So I'm excited to share here. So let me just get right into it. So, here at Rhodes Chiropractic, first of all, I believe we just have an amazing staff. We had a patient of mine, her daughter that brings her to her appointments, asked, and she's probably listening to this, would you train other medical clinics on how to treat their patients? I'm like, what do you mean? She's like, oh my gosh, I can't believe how amazing your front desk staff is on the phone. They greet you. And so to me, that's really important. So, as a new patient, what you can experience here, even just getting that first step going is just being greeted by, warm, welcome staff. All of our front desk crew is bilingual. So Spanish and English. Within our region, a huge percentage of Washington County is Hispanic. So being able to provide that service is amazing. And so, step one to me, how we treat our patients starts from when we pick up the phone or when we're texting. So people can text us, they can call us, email us to make their new patient appointment. And we really take almost every insurance. So that's one big question a lot of people have is what insurance do you take? But people can just pay out of pocket as well. So we have a mixture. We have people that pay out of pocket. We have people that have been in car accidents. We have people that have insurance through their employer or they're self-employed. So, all the major carriers, the Blue Crosses, the Providence, Moda, Cigna, Aetna, HealthNet, Kaiser. We take Care Oregon, all the Oregon Health Plan insurances, all the auto insurance plans. I'm probably missing a few, but Pacific Source is another one. So TriWest. I'm just going off memory here, but it's all on our website. But we take most of them. We'll do a courtesy benefit check. So we don't want anybody to have a surprise bill when they come into Rhodes Chiropractic. So we want to check, what do you cover? United Healthcare. So my second brain is thinking here as I'm talking, but a lot of Nike folks are on United Healthcare, so we take that as well. So we check insurance and answer any of those types of questions over the phone. And then we have an online intake. So from the convenience of your home, you can fill out your online intake and let the staff know what's going on with you. And so like most doctors' offices, you come in, but you've already got a feel for our office just with interacting and setting that appointment up. And the great thing about our office is we have 5 amazing chiropractors and we're open from 8 to 7. So for anyone that, gets off at 5 o'clock, a lot of doctors' offices close at 5. So that's why we stay open late till 7 to provide care for those folks. So we're open, Monday through Thursday, 8 to 7, and then Fridays from 8 to 5. So I think those are great hours, and almost anyone can fit in a once a week, 2 week plan into there. And so we have 5 amazing chiros. We have a lovely female chiro. There's certain religions or people that just feel more comfortable with a female. And then we have 7 massage therapists, males, females. We have, some that speak Russian, Ukrainian, Spanish. So we do have some folks that only speak, Russian, Ukrainian. So it's nice to pair them up with a therapist like that. Um, and so you come in and you obviously fill out your paperwork like you would at any medical clinic, and get all the insurance stuff situated with the front desk. And then, especially if you're brand new to chiropractic, you will be taken back by our wonderful chiropractic assistants. Just like a normal medical clinic has medical assistants, we have amazing assistants that will greet you, bring you back, take your blood pressure, greet you, and give you a little welcome and let you know what's going on. And then one of the doctors will come in and they'll have an idea of what's going on from your intake and be able to, see what's going on, whether it's neck and back pain, and get an idea. And a lot of the times, our assistants will also ask if, the patients have had any prior um, imaging, whether it's x rays, MRIs. Those things are very important. And so the doctor comes in, and our main thing we talk about with any new patient is we have two main concerns. Number one is what is going on with this person? Like, what is their diagnosis? And number two, are they in the right place and can chiropractic help them? Those are our top two concerns, because there are some situations where, chiropractic massage is not the right solution for them. And so we want to make sure that they're in the right place and they're not wasting their valuable time and money and resources here. And we want to make sure that we're going to be able to help them. So, that's very important to us. And yeah, maybe on a later episode, I can share some of the cases that, we just couldn't help out with. And so, anyway, so yeah, the doctor will come in, and, we want to get a good history. Had a guest on about a month ago, and she said the mysteries in the history, and it's so true, is a good history will reveal a lot of what's going on, and we can really get a lot of valuable information from that history. And then we move into an exam. And the reason I'm outlining this is some people think chiropractors, it takes 1 week to it's a weekend seminar to become a chiropractor, and it's just rack them and crack them, lay down, we pop and go. And so, but it is an 8-year degree. You got 4 years undergrad, another 4 years of your grad school. So there's a lot of training that goes into it. And so, yeah, so after a good history, we get to the physical exam. So we do a posture analysis. We do ranges of motion. There's different things called orthopedic testing to determine where the pain is coming from, and I'll tell patients, we want to figure out, is this a joint issue? Is it coming from your joints? Is it coming from your muscles? Is it coming from your nerves? Is it all three? And so different tests that we do can help us figure out where this pain is coming from. So that's super important, doing the physical exam and potentially doing some nerve testing. So, and that is a huge part of our education, is knowing those tests and knowing also their limitations. And sometimes they don't tell us everything, but they give us some good information to figure out what it is. And so from there, sometimes we can figure it out right there, what's going on. Sometimes we need further information. And so often we will do x-rays. And the beautiful thing about our office is we have x-rays in-house. And so we can just walk down the hallway and take those x-rays. So if it's medically necessary, we will take x-rays. And so I had a new patient 2 weeks ago, and she had never had any x-rays, but was having some pretty severe back pain, and got a good history. And as soon as I did a test called Adam's test, I instantly could tell she has scoliosis. And so obviously we want to know, what degree of curve does she have in her back? And so we did the history exam, and then we went right into the x-ray room, and I told her, I'm quite certain that you have scoliosis, but let's make sure. And, she had been to a few other providers. They had never done any imaging, and we were able to, get into the x-ray room and take a few x-rays. We have full digital x-rays. So we hit the button and boom, within 5 seconds, that x-ray is up and the doctor can see, what's going on. Obviously, it takes a little more time to analyze and read those x-rays. But many times we can see right there what's happening. And actually, one of our doctors, Dr. Ogles, pulled me aside, and one of his patients had an injury, and he wasn't, sure, what happened, and we are able to identify, oh, he's got a broken rib, and so obviously we don't want to adjust him, and that's something that is going to, probably just heal on its own, but if we didn't know that information and we thought, oh, you just have a rib that's out, let's go ahead and adjust this, we would send him through the roof in pain and make him way worse. And so having that imaging is so key. And so back to what I was saying is taking those x-rays, I instantly knew and I could confirm, yep, you have scoliosis. And so we finished the x-rays. And so this is another big key point for someone new listening to this is many times we are not doing treatment on that first day. It's gathering information. And so, from my perspective as a doctor is how will I know what treatment to give you unless I have, all the information that I need to assess what's actually going on and what kind of treatment you need. So many times we are not doing treatment on that first day. We are, taking into consideration their history, our exam, and then it takes time to analyze and read those x-rays. And sometimes we sit down, we look at them because, you're doing your x-rays on the spot. And many times this has happened to me. Boom, boom, boom. I'm taking them. And, then we tell the patient, hey, we're going to schedule a review of findings. We're going to have you come back tomorrow or, next week. And we're going to go over these results together. But I'll sit down and after everything's going on and start looking at their x-rays. And there's a certain flow that doctors follow to read and analyze x-rays. And I'll find things that I didn't initially see when I was in the room with them. And so, that's one big reason we're not going to do treatment that first day is because we need to properly analyze and look at the x-rays. And we could sometimes make people way worse if we didn't know what's going on. And so after that first initial visit, we will have them come back, and then we will have had the time to assess and analyze and come up with a game plan or a treatment plan for that patient. So, and sometimes we will have to refer the imaging out to basically a chiropractic radiologist, someone that goes on beyond the 8 years to read and analyze x-rays, MRIs, CT scans beyond what a normal chiropractor can do. So we have an amazing doc in town, Tim Stetcher, that can do that for us. There's others around the country, but he'll give us a second opinion. Sometimes we need that too. And then we come up with a treatment plan. So then we'll have the patient back. And it does surprise me how many people say, wow, no doctor has actually sat down with me and went over my x-rays. And, normally it's just the doctor saying, yeah, they're all normal, or, hey, you got this. But it's not that common that a doctor will sit down and have the x-rays up and, go x-ray by x-ray through the results and show you what's going on. It's one thing to just tell them, hey, you have a curve in your spine, you got this. But it's another to have that x-ray in front of them and show them. And, it's crazy how some people are, wow, I did not know that this was going on with me. And even just educating people and letting them know what's going on can help them to start the treatment process, whether it makes them realize, wow, okay, yeah, I really need to start stretching or start exercising. So I think that patient education is a huge piece to their overall um, outcome and treatments. And I don't want, you know, we don't use, some doctors will use these scare tactics and fear and, oh my gosh, you better do this treatment or else. It's not that. It's just making them realize, hey, this is why this is happening. And if you do nothing, this is where it's going. Um, and this is why I'm recommending this treatment. This isn't for me. This is just what your body needs. And so from there, it's looking at the x-rays, putting everything into consideration and then giving them a treatment plan. And so we don't have a one size fits all treatment plan. They really do vary. And so at that second appointment, the doctor will go through a treatment plan for you. And one other piece of our assessment that is a little bit newer to our process that I left out on accident is if there's a foot component or knee, your feet are the foundation of your body. And so, like I just had a patient this last week that said, yeah, I've just been this way my whole life. And she had a really flat foot just on one side. She said she was born with that. She's like, yeah, my family kind of made fun of me for this. And I have this one foot we call it overpronated. And putting the pieces of the puzzle together, I realized, wow, that is one big reason you're having the knee pain, the back pain. And so, we have a 3D foot scanner in our office. So if it's anything to do with feet, knees, something like that, the foundation of your body, we will scan the feet. And for her, in her treatment plan, we are also including some custom orthotics to help her with that right foot, because we could adjust her all day long, but if we're not fixing that foundation, it's not going to lead to sustained results. So that's one other piece of our analysis. Foot health is so important, and we don't overstep our bounds. We're not podiatrists, but if it's something as simple as ordering them some custom orthotics, we can do that, and so that does come into play as well. And so yes, there is no one size fits all treatment plan. I mean, we do see, a lot of the same things over and over. And so sometimes it is the same treatment plan for a certain condition. But, there's a variety of severities of conditions. And, some people are once a week for 4 weeks. We have other folks that are in really bad car accidents and they're coming in 2-3 times a week for, a month or two, and then on down to one. And so our whole goal is obviously to get fast healing, get people out of pain as quick as we can, and then get them to a point of to where that pain is minimized or hopefully totally resolved, and then give them tools and help them to where that condition will not come back. So a lot of that's through strengthening. So, we're huge fans of, working with PTs and giving people home exercises, giving them the tools to strengthen, the muscles around that area, and give them the tools, whether it's, stretches, exercises, or a lot of times I'm giving people proper pillows or having them buy a new mattress, because that's the thing that's causing the back pain. But, giving them tools to minimize flare-ups or that issue coming back. Now, do some people need maintenance for somebody that has, let's say, a 30 or 40 degree scoliosis? They're an adult. And is it going to flare up here and there? Yes, there's some people absolutely like that. But there are also people where we, help them, they get better. And, we might not see them for, a year or two, and then something else pops up. So, but coming in and going over those exam results is key. And we invite people's significant others too, just because it is different. A lot of people don't know what chiropractic is. And so having their spouse come in and really understand what's going on can get them on board and they can be their cheerleader and help them out with their home exercises or understand the investment that they're making in their health or getting a new pillow and that sort of thing. Um, and so once everybody's clear on the plan, then that's when we do our first treatment. So that first treatment, we really do. If someone's never been adjusted, we walk them through what is it like getting adjusted. So almost everybody knows you go to the chiro and you hear some kind of crack. And I like to joke around that I'm Portland's best crack dealer. But you do hear, and it can be very startling. And I remind our providers that, look, we do this all day. It's, just second nature to us. But for someone that has never had their neck adjusted, this is a big deal. And they can be really, nervous about it. So we got to slow it down, walk them through it. And so we'll walk them through what that really is. And so when you get adjusted, you hear that popping sound. It's gas bubbles that are trapped in what they call synovial fluid. So there's fluid in your joints. I kind of tell people it's like oil to a car. It's to lubricate the joints, keep that engine healthy. So there's gas bubbles that formulate in there. And it's like opening up a pop can. That pressure gets released. So having an adjustment releases all this pressure. And most of the time, after that initial kind of shock, people feel amazing. So I'd say most of the time, people feel better range of motion. They feel pain relief pretty instantly, and just walk out feeling great. So it depends on the condition, of course, but a lot of people, that first, adjustment or two, that they're feeling great. They're feeling awesome. It's not always the case. There can be soreness. People can have, headaches. Of course, that there's risks to everything. So that's the other thing, is walking people through, the risks associated with getting adjusted. So we will do that and make sure they're clear and any questions are answered. And then we move into the first treatment. And we don't do super aggressive adjustments on the first treatment. We go a little lighter and then we work our way up. And there's also certain patients where hands-on adjusting, where you hear the popping, we don't do. We have different instruments called arthro stim tools that can provide, manipulation to the spine without the popping. So it might be a young child. It might be someone in their 90s. So there's different methods and ways to, get those joints moving. And we have, other tools in our tool belt. Obviously adjusting is our bread and butter. It helps a lot of people get better. But we have massage for, muscle issues. And so a lot of times we're integrating, a chiropractic treatment plan with massage. And I like to say it's like brushing and flossing. They go hand in hand. And if you ask your dentist, what one should I do? Should I brush or floss? They'd probably say both for optimal results. So many times we're integrating both chiropractic and massage into that treatment plan. And people often adjust better when they've had those muscles, that tight muscle worked out. We're able to get a better adjustment. So many times we are doing both. We also have a machine called Shockwave, which really does a great job with things like plantar fasciitis, any kind of stubborn tendinosis, anytime you hear of a tendinitis type thing that's just not getting better. So those are just a few of our tools. We have something called decompression or traction for, stiffness in the back or disc bulges. So our tables will decompress your back. It's like someone tells me, man, it feels really good when I just kind of let my body hang from a pull-up bar. That tells me your body really needs to be decompressed. And so we have tables that do that. And so we put, the proper tools in place to, get you better. And then we do reassessments. So, 4 or 5 weeks go by, we're going to reassess and make sure that we're getting the results that we're looking to achieve, and make sure that, ongoing treatment is necessary and that our original treatment plan is still the proper plan for you. And so we have checkpoints to make sure that you're progressing as you should given your condition. And so some people may have a couple week treatment plan. Some people that are in a, really bad car accident, we might treat them off and on for a year and work with other providers. So I've had MDs on this podcast, Dr. Ho that works down the street. We work with surgeons, we work with PTs and naturopathic doctors, like Dr. Jones that does PRP and stem cell injection. So an integrated approach is often best and gets, the patient the best results. So we work with other people's providers for sure. And it really is about the patient. Our core value, our first core value is people first. So we're not here for us. We're here for you, for the patients, to get them better and really to give them the best experience possible. So we're not perfect. We're all human beings and things happen, but we really do try to treat everybody like their family and give them our best. And so that is the walkthrough of what it's like to become a patient at a chiropractic office. Now, I can't say every chiropractic clinic does it that way, but that is, an overview of how we do things at Rhodes Chiropractic. So if you have a family member, a friend that has been thinking of, doing chiropractic, please send this episode to them. This would be a great episode for them to listen to on their car ride. And I can't tell you how many people come in full of fear, just nervous. What are you going to do to me? And a couple months later, this is my favorite place. I feel so good. I didn't know you guys did, chiropractic was like this. This is amazing. And so, and we'll do free consultations. So if somebody's not sure if chiropractic is right for them, we are happy to do a free consultation with them. So thanks for listening. I hope that helps, and we'll see you on the next episode.